Good day to you. My name is Dr. Simon Wade, the Webinar GP. Just wanted to give you a little update on the next CPD webinar for GPs, which is bipolar disorder in primary care. And that's on Thursday, 19th, Thursday the 19th of February, 8 p.m. to 9 p.m. with Dr. Daniel Dietch. Now, it's actually going to be part one because in discussing with Daniel a few days ago, realized that there's so much material that is important to share. I didn't want him to prune what is normally a 2 to 3 hour educational session into 1 hour. That would be too severe a pruning. So this Thursday, the 19th of February is part one. And on the 2nd of March, Monday, the 2nd of March in the evening, will be part two. So Thursday, the 19th, 8 p.m, Daniel Dietch, Dr. Daniel Dietch, presenting on bipolar disorder in primary care. He advises that bipolar disorder is complex, but GPs can play a key role. And this presentation will help clarify some of the diagnostic and management issues. And the learning outcomes, certainly we'll get through the first three of these in part one. So the first one, why is there some controversy about bipolar disorder? Secondly, what's the difference between bipolar 1 and bipolar 2, and why does it matter? And thirdly, admission avoidance, how to stop an episode of bipolar escalating, how to stop an episode escalating so that you can hopefully avoid a hospital admission. And then learning outcomes 4 and 5, we'll likely do those on part two, which is some useful non-pharmacological strategies that you may not have heard about. He mentions orange-tinted glasses and omega-3 and nutrition, so I'm very interested in that. And also what to do with that lithium result. When blood lithium results come through, how we can act on those in an appropriate and informed manner. So each webinar is equivalent to 1 CPD credit, and obviously if you can show impact later on, whether you do an audit or write up some notes after 2 or 3 months and show you by your notes that you can demonstrate that you've changed your practice, then obviously you can double the CPD credits. So just a little bit about Daniel Dietch, Dr. Daniel Dietch. He's FRCP, DCH, MRCGP. Daniel graduated from Manchester University in 1992, gained experience in general and acute medicine before moving to general practice in 2000. He's been a partner at Lonsdale Medical Centre, which is a large teaching practice in northwest London since 2001. And Daniel's got a diverse range of interests, including mental health, nutrition, rheumatology, and internal medicine. And within primary care, he provides an innovative service for patients with bipolar disorder. And he works closely with GP and psychiatry colleagues. And Daniel has presented at academic meetings, including at the International Society for Bipolar Disorders, the Royal College of GPs, Royal College of Psychiatrists, and the Institute of Psychiatry in London. And remember, when you register for the webinar, you're emailed a unique set of login details. They're unique for you. So if you try and share those, they're only good for one access. So if you share them, you're not going to get on yourself. So your login details are unique for you. If you can't make the live webinar, as long as you've registered, then you'll receive an email within 48 hours after the live session, and that'll contain a link to access the recording and watch it at your leisure. So who am I? As I said, I'm Dr. Simon Wade. I'm called the Webinar GP, and I've been running live and interactive web-based seminars or webinars, providing quality CPD, continuing professional development, and continuing medical education, CME, and CPD for GPs and nurse practitioners. And I've been running these every week since January 2013, apart from Christmas week and New Year week, where I take a week off. But it's been hard work, but great fun. We're growing the number of GPs and nurses who are discovering what a smart way this is to take your CPD and collect your CPD credits the modern way. So CPD from the comfort of your own home, that's my mantra. I'm all about helping GPs, colleagues have a better work-life integration. I'm not sure you can call it work-life balance, but work-life integration and providing quality, efficient CPD, cutting down on travel time and travel costs, more time at home, less time on the road. That's got to be good for you. It's certainly good for me to do it like that. So look forward to seeing you on the webinar. All these webinars are live and interactive, and as I say, the recordings are available afterwards, but live and interactive, you get to ask your question and get an answer. So hope to see you on the webinar. Thanks for your time just now.